body, radiation therapy will be recommended to treat the cancer. Radiation therapy uses strong X-rays to kill the cancer cells. All of these treatments are offered free by Remote Area Medical. You have the choice to have the treatment or not. If you don't want to have the treatment, no one will make you. As I mentioned before, cervical cancer is a very dangerous disease. If the disease is growing outside of the cervix, it's very hard to treat. Even women with the best medical treatment may die from a large cervical cancer. A pap smear is a test that is used to find abnormal cells of the cervix before they become cancer. Remember that moderate and severe dysplasia can be treated in the clinic with a LEAP procedure. Now, I would like to talk about the symptoms of cervical dysplasia and cervical cancer. Cervical dysplasia will cause no symptoms. Women with cervical dysplasia will not know that they are sick. They will not have abnormal bleeding or vaginal discharge or pain from dysplasia. Women with a cervical cancer that is small will have no symptoms either. As the cancer grows and spreads to other areas of the body, the woman will have symptoms. The first symptom is usually vaginal bleeding and discharge with a bad smell. When the cancer grows outside the cervix, there can be pain and blood in the urine and stool and other serious symptoms. It takes many years for the cells of the cervix to change from normal to dysplasia to cancer. This means that there are many years that a pap smear could find these problems and a woman can be treated and her life saved. There is a virus that causes the changes of the cervix that can become cervical cancer. This virus is called HPV, human papilloma virus. This is not the HIV virus. HPV is actually a group of many types of viruses. Some cause no symptoms, some can cause warts on the feet, some can cause warts on the genitals, and others can cause changes in the cervix that can become cancer. HPV is very common, and most people will have the virus at some time in their life, but only some women will get cancer from it. Men can have the HPV virus and can have genital warts, but because men do not have a cervix, they cannot get cervical cancer. Most people with HPV infection on the cervix or the penis do not know that they have it and have no symptoms. Usually the body will get well without us ever knowing, but in some people the body does not get well and the virus stays on the cervix and can cause the cell changes that become dysplasia and cancer. HPV is spread from one person to another. It is not spread in blood or breast milk like HIV, but like HIV, it is spread through sexual intercourse. Being faithful with your partner, using a condom, or abstaining from sexual intercourse will help protect you from HPV and HIV. But remember, HPV is very common. Most people will have HPV at some time, and most of them will get well from the virus without ever knowing that they had it. Women that have never had a pap smear want to know what it is like to have this exam. Many women are nervous about the exam because they do not know what to expect. The exam is very simple and quick. It only takes 2 or 3 minutes to have the exam and pap smear. During the exam, the doctor will ask you to take off your shorts and underwear and lay down on the exam table. The doctor will look first at the area around the vagina to make sure the skin there is healthy. Then the doctor will use a speculum to look at the cervix and collect cells for the pap smear. Finally, the doctor will feel inside and make sure the cervix, uterus, and ovaries feel normal. Most women will have no pain from this exam. Some women will have light vaginal bleeding called spotting for 1 or 2 days after the pap smear. This is normal and happens because the tissue on the cervix is thin and may bleed when rubbed. You can do all of your normal activities, including sexual intercourse, after a pap smear. All women aged 21 or older are recommended to have a pap smear. It's no problem to have a pap smear if you are menstruating, pregnant, or have reached an age where you no longer have periods. That's called menopause. All of the pap smears done by the RAM team are read by doctors in the United States. The results will be brought back by the next RAM team or sent to you directly. It usually takes about 6 months to get your results. If you do not come to the clinic, we will leave your results in a sealed envelope at the clinic where you had your exam. If you need treatment, we will tell you what to do. A pap smear is a safe, easy, and painless test that all women should have. It is offered free by RAM and it is used to find changes in the cervix that become cancer. Cervical cancer is a very common and deadly disease. Having a pap smear is the only way to prevent cervical cancer. Thank you for your attention, and we wish you good health. And we wish you good health.